So today we are going to discuss about the root cause of three main deadly diseases in the world. Number 1, stroke. Number 2, heart attack. Number 3, pancreatitis. Okay. So actually our topic is lipoprotein transport and their composition. Many students don't understand that lipoproteins form the basic of these three diseases. They are the basic. Now, if you talk about lipoprotein, do you know what do you mean by lipoprotein? If you open any biochemistry book right now, then you will see lipoproteins are discussed under the heading of lipids. But that is actually not true, with respect to many authors. Lipoproteins are actually made up of two things, that is lipid and proteins, that everybody know. But there is a difference here. The difference is, you will have to understand that lipoprotein, if I just want to suppose, if I just want to get the simple answer or straightforward answer, that is, what is lipoprotein? What will be your answer? It's a lipid, it's a protein, it's a combination of lipid and protein. What is that? What will be the answer? If I want to know that what is lipoprotein, what will be your answer? Is it a lipid? Is it a protein? Or is it a lipid and protein? It is nothing. Listen, lipoprotein is actually a carrier of triacylglycerol and cholesterol. Now listen, first point you need to understand that many of you who are not giving any answers, okay, know that they are the carrier of triacylglycerol or triglycerides and cholesterol. Many of you know that. But you probably don't know why cholesterol and tags need this type of carrier system. Listen, suppose if I draw, suppose this is your blood vessel, okay, and suppose this is blood, okay, and it has got RBC, okay, it has got WBC, okay. What kind of WBC is this? With kidney shaped cell, monocyte, right? Now listen, if I draw, this is RBC, this is WBC, these are red blood corpuscles, and this is your plasma, right? Now, plasma, what is the important concept of plasma? We'll talk about body fluids later, but right now we need to understand what is a plasma. First of all, you need to understand is this, that plasma is a colloid. It's a colloid, and majority of this colloid is made up of water. Majority of it is made up of water. Now listen, just these two informations are enough for you to understand why tags and cholesterol need a carrier, because plasma contains more amount of water and tags and cholesterol are actually never soluble in water. They are lipids. This is a lipid, this is what? This is an alcohol, right? But this type of alcohols which contain what? An aromatic ring-like structure, not aromatic ring, they contain aromatic ring-like structure, they are not soluble in water, they are hydrophobic, they have hydrophobic structures inside them. That's why this type of alcohol, though it is an alcohol, alcohols in most of the cases are highly soluble in water, but though this is an alcohol, but they will never dissolve in water. Now listen, tags and cholesterol, as they are hydrophobic, therefore they are not miscible in water, and that's why they need a special carrier like lipoproteins. Clear? Claro? Now listen. Now you need to understand that what is the structure and composition of lipoprotein. Next, you will understand that classification of lipoprotein, then you will understand metabolism of different lipoproteins. Clear? So these are the fundamental three questions or three important points on which our lecture on lipoprotein will be based on. Okay, these are very important for your USMLE and other exams. Clear? Now listen. The point you need to understand is this, that if you want to know the structure and composition of lipoproteins, first you need to understand is what is the classification of lipoprotein. Now listen, these two points are actually intermingled or they are mixed. Okay, today we will discuss these two. Now listen, and then we will talk about the diseases associated with lipoproteins, obviously. Clear? Don't forget anything with respect to diseases. Wow. Now listen. So if I want to classify lipoproteins, then you need to understand that what you will tell is there are LDL, there are VLDL, there are HDL, there are chylomicrons, and so on and so forth, right? Now you need to understand is this. If I tell you right now that you are classifying lipoprotein on the basis of LDL, VLDL, HDL, chylomicrons, so what is the criteria of dividing these particular things? Listen, whenever you classify anything, it is based on a particular, property, right? Whenever you classify a particular thing, it is based on a particular property. Then if I tell you that if you are classifying lipoproteins on the basis of, if you are classifying lipoprotein with respect to what, if you are classifying lipoprotein, then if you are getting LDL, VLDL, HDL and chylomicrons, and if I tell you on what basis you are actually dividing them, then your answer will be on the basis of density. That means lipoproteins are classified on the basis of density and on the basis of electrophoretic mobility. Classification of lipoprotein on the basis of density uses the amount of lipid present in the lipoprotein, and classification of lipoprotein on the basis of electrophoretic mobility uses amount of protein present in the lipoprotein. Clear? That means if you have got this term lipoprotein, it is because it has got lipid content in it and it has got protein content in it. If you are classifying lipoprotein on the basis of, if you are classifying classifying lipoprotein on the basis of lipid content, then you are actually classifying lipoproteins on the basis of density. And if you are classifying lipoprotein with respect to proteins present, then you are actually classifying with respect to what? Electrophoretic mobility. Clear? Okay? Okay. Now listen. We will start with the most easy one, that is which you all know, that is on the basis classification of lipoproteins on the basis of density. Listen. On the basis of density, if you want to classify lipoproteins, then you need to understand that there is what? Chylomicron, there is what? LDL or VLDL, there is VLDL, very low density lipoprotein, right? Very low density lipoprotein. Yes, I know how these things work for pancreatitis, obviously, but the point you need to understand is this is actually a biochemistry class, okay, and not a molecular pathology class. We'll talk about this when we'll talking about in details molecular pathology. Okay, for the timing, for you at least, I will tell what is pancreatitis, obviously. Just be patient and be positive, okay? And for the timing, please understand that I know better than you, okay? Now listen, that is LDL, low density lipoprotein. Clear? And then it is high density lipoprotein. Now listen, then it is high density lipoprotein. Now you need to understand is this, why I have maintained these things, chylomicron, then VLDL, then LDL, then HDL. You need to understand is this, that if I draw a box here, if I draw a box here and a box here, and if I draw an arrow here, then you will have to understand this thing, that is, if you are coming from bottom to top, then you need to understand in the bottom there is high density, that is low fat and high protein content. I knew it that you will have problem that why this high density lipoprotein has high protein and low fat. Very good. We'll talk about density. You know, probably don't know what is the important definition of density. What is the definition of density? Mass per unit volume. Everybody is saying that mass per unit volume is the definition of density. Do you understand really what is density? No. Don't worry. Yes, you should laugh at yourself. Listen, point you need to understand, if you don't know the definition of density, you are actually treating patients who have actually this type of indexes which are really important for you people to understand that you are going to treat patients. That's horrible. Listen. So HDL has low fat and high protein, and at the bottom we have high fat and low protein content, right? Now you need to understand a very different perspective here, that first of all you need to understand why, as the percentage of fat increases, listen with all your attention. An important fact note is this, you need to understand this always, that as percentage of fat increases, density of lipoproteins decreases. You know that, right? As the percentage of fat increases, density of lipoprotein decreases. Why it is so? Now, suppose in a container, let me give you a very tough thing, because probably you can't answer this also. If I tell you that I have filled this particular bottle or this jar with water, and over it I am pouring oil, then oil will be over water or water will be over oil? Oil will be over water, right? Right? Oil will be over water, everybody knows that. Then why it is so? Because the density of water is greater than the density of oil, right? Right? You know that. But why? My question is why? It is not a biological question or something like that, it's a common sense. Listen. If you really want to answer this question, understand this. Suppose this is a container, okay? And you fill it with water. Okay, now listen. Suppose this is a two-dimensional figure of this container, and you fill it with water. Suppose these are water molecules. How many water molecules you can fill or pack here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14, right? 14. Now, if you draw a similar vessel here, and if you want to pack this similar vessel with oil or fat, oil is what? Triglyceride, and it will take much more space than this, right? That means, or maybe max to max like this or this, right? Do you think you can fill more amount of fat here in this container or here? Suppose this is container number 1 and this is container number 2. Which container will have more amount of fat? Container number 2 or 1? Now listen. So that is the density of this. So what is density? Now listen. What is density? Density is equals to mass by volume. Now if we take the volume constant, then the mass will actually, then if you take the volume constant, that is we are taking similar petri dishes, then density will be proportional to mass. Now listen, which has got more number of molecules? Which has got more number of molecules? This. That means density of water, that's why is more than fat. Clear? Now listen. Again, understand this very basic thing. As the percentage of fat increases, density of lipoprotein, that's why it decreases. Clear? As the percentage of fat increases, therefore density of lipoprotein, that's why decreases. Clear? Now understood? Now you need to understand that what is actually lipoprotein density. So now, so as the percentage of fat increases, density of lipoprotein decreases. Okay. Now, very important point here you need to understand is this, that what about protein? Now listen, lipoproteins are actually made up of two things mainly. Lipoproteins are actually made up of two things, that is lipids and protein. Lipoproteins are actually made up of two things, that is lipids and proteins, right? Now you need to understand a very different perspective of lipoprotein, that is, for the transfer of these lipids, protein is required. Understand this very basic thing. For the transfer of these lipids, that means I was telling that lipoprotein was a carrier. Now you need to understand is this, that lipoprotein is a carrier of what? Lipid or protein? First point, lipoprotein is a carrier of lipid. Now who helps in actually carrying? Proteins. Clear? And whenever there is a protein, you know, if a protein is helping your body in something, then it has got gene, and the mutation of those genes leads to disturbances in the lipoproteins. Those disturbances are known by the name of A-beta lipoproteinemia, hyperchylomicronemia. Don't worry, we'll talk about that. But first things first, you need to understand is that is lipoprotein is made up of lipoproteins are made up of two main things, lipids and proteins. Now, those proteins which are present in the lipoproteins are given a special name, that is apoproteins. They are given a special name, that is apoproteins. Clear? There are many classes of apoproteins, we'll talk about them, don't worry. And the lipids which are present in the lipoproteins are first cholesterol, cholesterol ester, then triacylglycerol, okay, and a small amount of phospholipids as well. Clear? So these are the four types of lipids which are actually carried via lipoproteins in your body. Clear? Now back to this discussion. If I am talking about chylomicron, then chylomicron has got high fat percentage and low protein percentage. That means what? Chylomicron is the most loaded. Chylomicron is mostly loaded with cholesterol, cholesterol ester, tags and phospholipids, right? Wrong. Listen. Chylomicrons are mainly loaded by triacylglycerol or tags or triglycerides. Clear? They contain cholesterol, cholesterol ester obviously and phospholipid, but they contain maximum amount of tags. Clear? They contain maximum amount of tags. Now listen, what is the composition of VLDL now? Listen again, like chylomicron, VLDL is also mainly or chiefly made up of tags or lipids simply. Okay, now LDL are mainly carrying cholesterol. The first difference, that is LDL carries cholesterol. Clear? And HDL carries mostly apolipoproteins and mainly formed of proteins and little amount of cholesterol, and they contains a significantly higher amount of phospholipids compared to these three. Clear? Now listen, there is something called good cholesterol and bad cholesterol. Listen, doctors use these terms, no? Good cholesterol and bad cholesterol. If you tell any doctor what is the meaning of the term good cholesterol, they will say that the term which is actually known by the name of good cholesterol is actually HDL. This is known as what? This is known as good. Yes. Good cholesterol is what? High density lipoprotein. High density lipoprotein is also known by the name of good cholesterol. And what do you mean by bad cholesterol?
Obviously LDL.
Bad cholesterol. Bad cholesterol means what? Now listen, even after this class, if you think that LDL is much more bad, you need to understand or revisit your you know, knowledge, because VLDL is much more, you know, bad than LDL. Okay, VLDL and LDL, both are known by the name of bad cholesterol. Now listen with all your attention. Listen, the term that you don't know about good cholesterol and bad cholesterol. How can a cholesterol molecule, listen, cholesterol is an alcohol. How can a cholesterol molecule be good or bad? Listen, a cholesterol molecule cannot be good and bad. But what do you mean by good cholesterol is high density lipoprotein? A particular term is missing here, you know, and you don't know that. A particular term which is missing here is good cholesterol transporter. The most important term is missing here. It's a good cholesterol transporter. This is the term you need to understand as a doctor. Okay, that is, a good cholesterol transporter is HDL. That means it is a transporter of cholesterol which has the ability to take maximum cholesterol inside it. And a bad cholesterol transporter, listen, and a bad cholesterol transporter means it is already loaded with many cholesterol molecules. How can it take from your blood more cholesterol? That means it cannot transport more cholesterol. That's why it's a bad cholesterol transporter. There is nothing by the name of good cholesterol or bad cholesterol. There is a good cholesterol transporter and bad cholesterol transporter. That's it. Clear? Okay. So we have up to now discussed the classification of lipoproteins based on density, and when we were discussing the classification of lipoproteins based on density, we have already discussed the contents of lipoproteins, that is they are made up of lipids and proteins. There are actually 4 types of lipids there: cholesterol, cholesterol ester, tags and phospholipids. Proteins, and in the proteins there is apolipoprotein. That means apolipoproteins are the category of proteins which actually are present in the lipoproteins. Okay, what do you mean by good cholesterol transporter? What do you mean by bad cholesterol transporter? Clear? Okay, now we will shift towards the classification of lipoprotein based on electrophoretic mobility. Clear? We will now discuss classification of lipoprotein based on electrophoretic mobility. If I take an electrophoretic tank here and dip a strip in it, and if I add the electrodes here, now you need to understand is this is the negative terminal, this is the positive terminal. Now listen, which is cathode, which is anode? This is, I'm not going to discuss it even. This is anode, positive terminal is always anode, this is cathode. Now if we put a dot or a, you know, we put a sample here, and if we allow this sample to run, you know, we'll get some bands. Here we'll get a band, here we'll get a band, here we'll get a band, and here actually we'll get another band. Clear? What are these? Now listen, from the bottom we'll rise to the top. Now listen, what is the name of this band? This is known by the name of alpha lipoprotein. What is the name of this band? This is called beta lipoprotein. Now listen, this band is before beta lipoprotein. That's why it is known by the name of pre-beta lipoprotein. And this is what? This is your masterpiece, that is chylomicron. Clear? This is alpha lipoprotein, this is pre-beta lipoprotein, this is beta lipoprotein, this is chylomicron. Now, why I was not talking, there is someone who told me that there is another type of lipoprotein which is intermediate density lipoprotein, ideal. I know that obviously, but can you find intermediate density lipoprotein here? No. Why? Because you know that intermediate density lipoproteins are actually obtained from LDL, HDL and all these things. Actually not HDL, LDL and VLDL. Okay, that's why they are known by the name of intermediate density lipoprotein. They are actually not present in your blood, they are actually converted. Because if it was present in your blood only, then you would have actually got here, but actually you get intermediate density lipoprotein because to some extent not every VLDL which is changed into IDL gets absorbed readily. That's why you will get it. But if you take a blood sample, probably will not get ideal band. Okay, you may get, but this is the more probable picture. Now listen. When we were classifying lipoproteins on the basis of density, we have got what? Chylomicron. We have got VLDL. We have got LDL. We have got then HDL. Right? We have got chylomicron. We have got VLDL, then LDL, then HDL. Right? Now, my question is: suppose this is your chylomicron. Can you tell me what is the name of alpha lipoprotein? If you follow this, you know it, right? The name of alpha lipoprotein is HDL. Why? Now listen. If you consider this strip, okay, let me draw it here. If you consider this strip, you have put a positive terminal here, you have put a negative terminal here. Now listen. HDL has got highest concentration of protein. HDL has got highest concentration of protein. That's true. Now you need to understand is this. If HDL has got highest concentration of proteins, then in your body pH, what is your body pH? 7.4. At this pH, all the proteins are negatively charged. Do you know? All the proteins are negatively charged. We have read in protein biochemistry. All the proteins are negatively charged. That means that means HDL has got highest concentration of proteins. That means HDL among these four have highest amount of negative charge. That's why it has run towards the positive charge swiftly. Clear? Now above it there is pre-beta lipoprotein. LDL is, that's why known by the name of pre-beta lipoprotein. Why? Because concentration of protein is much higher. Now listen, what happens is this. Suppose this is chylomicron, this is your VLDL, this is your LDL, this is your HDL. Now what happens is this. Suppose this is your chylomicron, this is your VLDL, this is your LDL, this is your HDL. You need to understand is this, that if it is chylomicron, this is VLDL, this is LDL and this is HDL, what is actually changing? These things are becoming smaller, right? They are actually losing lipids. If chylomicrons actually loses lipids, they will become VLDL, or if they loses then becomes say LDL, HDL or something like that. Now you need to understand is this, they are losing lipids. If there is a seesaw here and there is lipid portion of lipoprotein standing or sitting here, and there is a protein part is sitting here, if lipid portion is actually steadily decreasing, then protein portion will have to win, right? That means what? HDL is having more protein. No, HDL has less lipid. That's why they have this electrophoretic mobility, because lipids are electrically neutral, they cannot move, and they become a bulk, and they become actually a resistance for this movement, electrophoretic mobility. Clear? Now what is the name of beta lipoprotein? You know now. VLDL and chylomicron will try to move, but they cannot move. They're like sumo fighters, Why? Because chylomicron has the highest concentration of what? Lipids, and lipids are electrophoretically neutral. Clear?